Hi, everyone. I'm Dr. Katie from Scribenote, and here we are on another episode of What's Up, Doc. Today, I have two special guests with me, Dr. Emily Mary, also from Scribenote, and Dr. Megan Painter, who is a dermatologist in Boston, I believe.
Yep.
Okay, we're going to have her tell us a bit about who she is and what she does, and we're going to get into some really fun, super useful clinical derm review.
Thank you so much, Katie. I have been looking forward to this experience for a while, and I'm happy to introduce myself. So, I'm Megan Painter. I am a board certified veterinary dermatologist, and I work for Angel. So, it's part of the MSPCA Angel. They have a satellite hospital in Greater Boston in a town or city called Waltham. And so, I'm there, and I'm the full time dermatologist for Angel. So, it's a great experience. I'm very busy and love supporting the referring veterinarians that we see in the area. I also am the founder of my own company called the Allergic Dog. And this has been a company that I've had since 2021. And the purpose of this company originally was to help veterinarians and to support them in treating allergic disease in dogs and cats. I do have information about cats as well. And to really help provide a good foundation of education and just morale boosting around allergic cases, because we all know we're seeing a lot of allergies in dogs, and this condition is really variable. There's a lot of ways that dogs present with allergic disease, and it creates a lot of confusion sometimes because you're just like, but why didn't the Cytopoint help? Or what did I do wrong in this case? And so helping to provide some, just good support and practical knowledge around this is one of my passions. So I'm excited to talk about that on this podcast. And thank you so much for the invitation.
You're welcome. Yeah, I'm excited about it too. As a general practitioner, I see a lot of dermatology cases. I'd say every day, at least one, but most days, multiple, coming
Multiple.
in
Yeah.
for vaccines and having itchy feet or, licking different areas or scratching, shaking heads, right? So I feel
Yep.
like the allergic, disease is like the biggest thing you see in general practice because it crosses so many of those appointment types. Like it's not just something that you see in allergy appointments. You're seeing it in healthy annuals where people have no concept of what's happening. So
Absolutely. Yeah.
really,
And you might be the one noticing it, or they're the one noticing it. But either way, this is a condition that we know is going to increase in terms of frequency in all populations, including humans, including dogs. And so our readiness and ability to respond to this appropriately and safely is so important because we want to provide the right messaging to owners so that they're not overwhelmed. But we also want to provide the right treatment plan to our patients so that they don't have to spend their days being miserable because of their skin or ear problems.
yeah, and I find it's one of those things that can be so variable in how it's handled in practice because whether there's just not enough like continuing education or time because the appointments take a really long time. And
Absolutely.
there's a
Yeah.
lot of follow-up and there's a lot of education surrounding them. So today I really wanted to get into like a kind of myth versus fact buster type of scenario and then maybe go over any new grad questions or concerns about dermatology and how to approach it in clinic.
Yeah, that
So yeah,
sounds great. I
awesome.
think we could talk about this is this going to be like a 5-part series? I don't know.
I mean,
So it's
we
like,
certainly could do something
how
like
much time
that.
do you have there?
Yeah, I feel you there. Myth or fact, food allergy blood testing is beneficial.
Myth.
Yeah, I agree.
Yeah, firm myth.
Okay.
So let's talk about food allergies. So the important thing about food allergic disease is that it is actually pretty common. I know that there's kind of in the past, there were mixed messages about how common this problem is. And I even find some colleagues who just don't buy into food allergy. And I think part of the reason is that prior to the creation or availability of really solid hydrolyzed foods, I think this was actually a pretty challenging diagnosis to make. And the reason was because we have a lot of cross reactivity with whole proteins. So we can talk a little bit more about exactly what that is. But if you're using a novel protein diet, the immune system might not think that's novel. And so you might miss that case. And so I think practitioners who were relying on that type of diagnostic might have just not been that rewarded by their process, right? They do a diet trial with, let's say, a salmon based diet, and the dog doesn't get better. So they move on. And then they think, gosh, no dogs have a food allergy component. But if you ask a lot of practitioners who are really doing a lot of diet work, I think a lot of us believe that somewhere from 25, I even have a colleague who believes 100% of his patients with allergic disease have a food problem. And, I was like blown away that this person thought more dogs have food problems than I do because I do a lot of food work. But it's what the question isn't so much yes or no. Does your dog, does your patient have food allergy? The question I have and how I phrase it is, what percentage of this dog's problem is related to food? And when you think of it that way, it helps break down some of that black white thinking that really traps us with allergy. One of the things that I'm really passionate about is breaking down some of the blind spots that we have in the diagnostic process and the treatment process for managing allergy. And I think that black white nature of like, it's either a food allergy or an environmental allergy is one of the biggest places that we can get trapped. And what I think happens is we want to test. And so people are reaching for tests to try to get these answers. And when it comes to food problems are pretty complex. And so we're eating food, there's maybe some sensitization, and then maybe you're going to have symptoms on, your skin or ears if you're a dog. And how do you test for that? Well, unfortunately, you really can't. The process from an immunologic perspective is very complex. And so you can't measure just simply IgE, which is what these tests are offering, in order to get a relevant answer to the question of what percentage of my patient's problem is driven by food. To get that answer, you have to do what I call a diagnostic diet trial, because I really want veterinarians and then also pet owners to remember that this is a diagnostic test. So instead of calling it the elimination diet trial, I twist it up a little and call it the diagnostic diet trial. And I think that helps reinforce the concept that this really is the diagnostic test for dogs to determine if food is part of their problem. It might be their whole problem. It might be 50% of their problem. It might be really nothing. And, how we get that answer isn't by blood testing. And specifically, it's not at all. We'll probably get there too, but another myth of saliva or hair. So certainly you cannot rely on those tests to get this answer. But when it comes to blood testing for food allergy, this is an unreliable test that does not match up with the patient's experience. So you might get a result that says, they're allergic to 27 different things, or they have IgE antibodies to these things. And then you go ahead and offer them those items and they don't clinically flare. And so the sensitivity and specificity of these tests is quite poor. And you just can't rely on this to make this kind of diagnosis. So myth.
Great. I have two follow-up questions for you. In a place like we are, so we're in Southern Ontario, where we've got, seasonal things happening for, from April, maybe February, depending on the weather,
Yeah.
till November, December. Is it still the best time to do a food trial when the environmental allergies are lowest?
It
Yeah.
doesn't matter. The truth is that if food is going to help a dog, it's going to help a dog. And when it comes to managing symptoms with medication versus managing the root cause of disease, there's nothing quite like treating the root cause really well. So if a dog has some seasonal influence and also some food allergy issue, the food allergy part of that patient's disease is going to get better. And so you're going to see improvement regardless of the time of year that you do a diet trial if that patient is, in fact, going to respond to the food. People always worry, how are we going to know if it's the food that's doing the heavy lifting? And I love that question because it implies that the dog is doing better.
Yeah.
And so I just encourage people to not even worry about that. Like, how are we going to know what's helping the dog? It's like, cool, one, the dog can be helped. And then two, we either challenge the diet with the previously fed food to see if the dog flares, or we discontinue the medications that the dog's on to see if the dog flares,
Sure.
or maybe both. And there's a way to figure that out. So that I think was probably a two-part answer to your question, but it is something where you can monitor the seasonal influence. We in New England have a heavy, relatively winter, and so I definitely have patients who are much better in January, and they just completed their 8-week diet trial and they're off their medication. They're doing great. And my message to the owner is good. Keep going with the food, continue it, and then let's see if they flare when different seasons roll around. If we come to this time next year and the dog hasn't flared, then, obviously we're good. And if they do flare, let me know. So there, I think, are ways to manage that.
Part two of that question is, do you recommend getting all infections pretty much cleared up before starting on a diet trial?
Here's what I think. Allergic dogs have a tendency for dysbiosis. So what do we mean by infection? Would be the first question I would have. Does it mean complete cytological clearance of their ear canal? Well, that might not be possible.
Right.
And so it's something where we want to put into context the entire situation. And, patients that I'm seeing are coming to me in lots of different forms, perfect and no lesions, and they're just coming in for, a referral to learn more, or absolute hot mess disasters. And if I want to get the answer on the role that food is playing for my patient, I do that test at that time. The hardest part is interpreting the diet trial when you have done a lot of things all at once.
Yeah.
And what I stress to the owner is, okay, I'm putting your dog on steroids for 6 weeks on a slow taper. We're going to start antibiotics. We're using these ear medications. We're going to do bathing, and we're going to do this diet trial. That's pretty complex. And that plan requires some patience and a little time. So I do think there's part of it on our end to communicate well about the limitations. I would love to be able to draw some blood today and get this answer, but part of the thing I really want to know is, does food control your dog's symptoms? And if it does, we are going to hit the lottery, or the jackpot of the lottery, I guess, right? So it's something where if food is the problem, then we are slowly going to solve this problem over the next 8 weeks. And doing this now is only going to speed up that process for your dog. So getting these answers as soon as possible is, and really, you can't go wrong with that.
Okay. And you don't find you lose people. Like you don't find they're like, oh, well, the infection's not cleared up yet. The food's not working. I guess, you've got the education and they've obviously are very motivated to solve the problem when they get
That's
to
right.
you. Yeah.
Yeah, I think I see a different kind of clientele, but I also think that what's important is that it's possible the food isn't working.
Right.
And so helping them with that information, like if you feel this way, a few things I do to help with success with diet trials are to set a reminder email. So we have a system where my technician will send an email 1 week after the first appointment to see how's it going.
Mm-hmm.
And then in the room before they leave, I set up the 8-week recheck to talk about the diet trial. And so, one, they have a way to get in touch with us because they got that email. It's not on them. Let us know how it's going. No, like, when was the last time? Like, any of us have time for that, but you respond to a question. So that's nice. And then the other is, it's not like, oh, call our coordinator and book it for 8 weeks. No, this needs to be set up now.
Yeah.
And so I think that really helps with, one, the understanding that this is a test that is a finite experience. It's an 8-week test. It's done for this period of time. It's not going to linger longer than it has to. And I tell people, never suffer. If this isn't working, or your dog doesn't like the food, or there's diarrhea, or there's some other issue, like, don't suffer through that. This is not the goal. The goal is for your dog to get better.
Right.
The other thing I do is provide a folder that has a tracker. So it's just a simple table that has date, poop score, itch, and then other notes for, like, husband gave a piece of bologna or whatever, right?
Yeah.
Always there's someone else in the house. That was always the problem.
Yeah.
And so that helps with a information about the like a handout, traditional handout about why you're doing this. And I think that helps people too, because it gives them something to ground on. But yes, it's tough when the dog flares during the trial. I try not to get too upset about that because that's kind of the point. So I think I coach people around that. If that happens, that's good. This is good information. Then we are working toward having the right diagnosis for your dog. If food isn't controlling the symptom, we can move on. Now great. Now we have the diagnosis of environmental allergy and we can really focus on good medical management and or immunotherapy if that's the direction we want to go in. So it's kind of those like one-liners, and I teach a lot of one-liners in my courses. So it's like I've been saying the same things, and like I feel like I have like those like little ways of just saying it, so then you don't feel so overwhelmed. But it didn't come right away. Like I've been doing this for a while. So if you're, Emily, brand new, you're like, oh God, how am I going to say this? It sounds hard. It is. And it just takes a little time to find your personal kind of style in communicating these messages.
I'll say it's really nice to hear your take on kind of marginal success is still success, or that
Yeah.
you have a like setback that's expected and it's good news. Because I feel like oftentimes we hear in IM or in like other industries or sectors of vet med that like no news is good news. We get that MRI back and it's clean. Like it's a good positive diagnosis. But with derm, it's like such a big, scary, daunting field that we don't have a ton of training in. And we don't really often hear from dermatologists like we don't want answers like because by the time
Yes.
you're getting to dermatologists like they're they're frustrated or they've got more emotions on play or more money in the bank kind of thing. So having you kind of lay that out, I feel like is really useful for me.
Yeah, I think another thing is like doctors in general, we're like really caring people, but I think we also are kind of a little like perfectionists. We want things to go right. And one thing you have to check at the door when you are seeing skin and ear cases is the idea that this case is going to be perfect. Now, that doesn't mean that the case should be a mess and that it's poorly managed. There's a difference. Allergic disease, and I tell this to everybody, allergic disease is a chronic relapsing condition, and we should expect flare ups. But those flare ups, if we're doing a good job with the case and we're using our medications well, and the case isn't some cases are just very difficult. So I will just put that little star there. Like I get it. Some cases are challenging. But in general, we have a lot of options for medical management. We have a lot of options for bats. We have food options. There's a lot for allergic dogs. However, can you assign the right protocol in 15 minutes or less, when you're also giving vaccines? Maybe not. So it's not to say that it's easy, but it is possible to find good plans for these patients. But even the best plan, you're still going to have a flare. Just remembering that this is a chronic relapsing condition, flares are expected, and how we think about those flares and how we talk about that with owners can really make a big difference to our own well-being with these cases, but also to help level up and help pet owners understand what to expect if their dog has allergies.
And I think like a lot of that, so like you mentioned the can you do it in 15 minutes? Maybe not. And the people are not always necessarily bought in because they don't even believe that it's allergies necessarily, right? If they didn't come to
Totally.
that problem. And so I like to call it like planting the seed. It's like you mention it, you kind of get them thinking about it, like thinking about, licking is also them scratching because they have no hands, right? So and just like kind of giving them this like clue to, oh, well, maybe try these simple things. And if that's not working, come back and we'll talk about blah, blah, blah. And like they're kind of buildable appointments. And like sometimes you feel like a broken record, but I think the more people hear it, like the more they like buy into it.
Mm-hmm.
I also think like there's a part of that people don't necessarily want their dog on medication, right? Like people
Yeah.
are very like, oh, a little averse. And so I think the best thing to do is to be like, does this impact your or your dog's life quality?
Hmm.
Because some people can't answer that and they're poor at managing, they just like don't quite get it. And the dog is obviously suffering and they're like, doesn't he look great? And you're like, oh, this is horrible. But like in general, I think that if you're like, yeah, my dog licks his paws, but it's for like 5 minutes, and does that dog then need soup to nuts, everything? No. So it's all in perspective too, so that we're not feeling like we are chasing a condition that the owner doesn't even see as an issue,
Right.
but then also helping the owner decide if it is a problem. Does this dog lose sleep because it's licking their paws? Like, that sounds terrible, and are you listening to this at 3 a.m. and getting frustrated? We can help with that.
Yeah.
So putting it into that context of life quality is key.
Myth or fact, dogs that lick their paws are bored.
Yeah, I don't know. I was just talking about this with my text the other day. Like, who started that
I
myth?
don't know.
I don't know. Like, really, I would love to know the author of that myth because I just don't get it.
Like
Dogs, I think there's like a part of soothing. So it's like maybe some self-soothing behaviors that humans do where they kind of like maybe rub their hands or um, I just don't know. I think that it is an interesting one where there's just not a lot of context on the boredom. What happens is if you are busy, you aren't really paying attention to things, So if you are, going through a breakup, what do people say to do? Instead of sitting around your house and wallowing, you go ahead and no one's going to be like, you're crying because you're bored. You're like, well, no, I'm crying because I'm sad and I like have to. But then what happens? You go to the mall or you go out with your friend for lunch and you kind of forget about it. Like it's just the same with dogs. Like they're licking their paws because they're itchy. Is it severe itch? Maybe not. It doesn't mean to say that like it's the worst thing in the world. Oh my God, they're licking their paws because they have allergies and it's now some horrible catastrophic problem. No, maybe they're just licking their paws because they're itchy, but they're definitely not licking their paws because they're bored. I think some dogs groom a little bit. Like they go outside and they have like dew on their paws and they might come in and like lick that, fine. But that certainly is not the like typical licking. Yeah, the boredom licking thing is beyond. I don't under. I really would love to know where that started.
Want to bring a
Yeah,
behavior expert on next and see their their
yeah,
thoughts.
Yeah, well, I mean, those lick granulomas are different than like itchy, like yeasty toes, I think. Like really
totally,
like different like localization even, right?
100%. Yeah,
So the next, I guess, myth or fact would be tape cytology is not useful.
love tape cytology. This is so
It-
funny.
It's
I think so. I use tape cytology and impression smears. I have all my courses. I have a cytology specific little lecture that I've done where I talk a lot about this. But I'm a very like practical cytology person, and like also, why are you doing cytology? Like I do think cytology. The like cytology everything movement is great because we don't want to diagnose infection based on smell or appearance. Like that's not right. But I do think like there are times where, I might choose not to do cytology. I'm doing it if I'm then going to elect a treatment, right? So if I'm going to be like, here's some antibiotics, like I really need to make sure that I actually am seeing bacteria.
yeah.
Tape cytology, I think, is very useful for hard to reach areas with your impression smear. So I use a lot of tape cytology for interdigital spaces, like the webbing of the paw. It's really hard to get a good angle for an impression smear in that area. So I do a lot of tape. The heart or like a vulvar fold, it's very sensitive. And so a tape prep could be great for that. The hard part with tape is that it's busy. So it can be hard to interpret. When you're using tape, my like pro tip is really it's a test for yeast. You can easily see tape yeast on a tape prep. Bacteria can be harder to see unless it's wildly obvious because the bacteria and the debris that you pick up with the tape can sometimes be very similar. So it can be just really hard to be like 100% certain that you are dealing with a bacterial infection. Neutrophils become a bit obscured. So it's for me, when I'm using tape, I'm asking the question, are there yeast? Yes or no? And if there aren't yeast and the dog looks like it has infection, I then will often go back and do an impression smear of that area to see what's going on, just to get a bit more clarity about neutrophils and coxibacteria. So that's my approach. Most of the time, though, I am able to, kind of go through my tape prep well enough to get the answer that I'm looking for. But for me, it's a great test. I had a mentor who was like, I bet I can pick up more yeast on an impression smear than you can on your tape prep. And I was like, one, not a contest. Two, like it doesn't matter, like it just doesn't matter. And three, you just do what you're comfortable with. So I think if you have good technique and your patient is compliant, you can use either method. But I do think tape preps really help with the exfoliation, especially for Malassezia dermatitis that you're looking for. So that's when I'm using that test.
And then a follow-up about the impression smears. So how do you find that those work on dry lesions? So like just itchy, dry, red skin. Like, are you reaching for tape in those cases or impression smears?
Impression smears on most skin.
Okay.
It's all about the angle and the technique. And what's so funny is like if I go back to when I was like week one of my residency, I can remember watching my mentor, Dr. Tiffany Tapp of East Greenwich, Rhode Island at Veterinary Healing Arts. She was doing these impression smears on like, all of her cases. And I'm sitting there just shadowing her and I could not do it. The angle, the way she held the slide, just the firmness, the everything, the technique was very difficult for me at first. And so I will say it's not necessarily easy or intuitive to be able to sample lesions that aren't wildly exudative. And so practice on, cases that maybe you're doing surgery for that just you don't have to deal with an animal that's kind of busy and around and, non-compliant, just to get that angle and the pressure that you need in order to be able to sample drier lesions or maybe scaly erythematous skin, because you can do impression smears for those. And I would recommend it over and above more to like, don't rely too much on just doing tapes because you're afraid to, or, not practice well enough for impression smears. And I'm happy to like help, but it's such a person, like you have to like really show people in person. I
And
can remember feeling like such a loser when I was in my, the beginnings of my residency being like, I literally have no idea how to even make my hands like hold the slide. Like I just couldn't do it. So now I'm fine.
do you review that in your course that
Yeah.
you, yeah.
Absolutely. Yeah. So the technique, the angles, like how to do this. So right now, courses that I have for vets, I'm recording after we have this interview. I'm going to keep recording for my ear course, which is I'm so proud of. I love it's all about ear infections and how to manage and think about that. There will be an anal gland course on anal sacculitis mostly, but then, the issues of anal glands. And then there's two main courses for vets. One's called Itch to Answer, which is about how to diagnose allergies. And so in that, there will be the cytology section of how to do impression smears and use this diagnostic test well. And then the other is Proven Protocols, which is a upgrade to Medication Masters, which is how to use medication. And that will include information on like topical therapy as well and immunotherapy, because that's these are the two most commonly asked questions that I get after graduates finish the course of Medication Masters. They want to know, all right, about bathing and everything after they've learned about medication. So yeah.
Awesome.
Exciting.
Well, if you want to check out any of those courses, it's the Allergic Dog or the
Theallergicdog.com.
yeah.
Yeah, exactly.
And
Yeah,
follow you on Instagram, right?
that's right. Everything is at theallergicdog.com or the allergic dog. I've gone through a few iterations with the name, but in the end, what I really care about is messaging around allergies specific to dogs. I think there's just a lot to learn and a lot to talk about. And there's so many myths and facts and ways to think and approaches that I think it's important to have someone who's not entirely married to, I'm not like on a high horse about anything in particular, just more I get it done in the clinic. Like I live and breathe this and I see what works, I see what doesn't, and I am open to gray zone. It's an interesting world right now when it comes to the diet, the pet food industry, the supplement world, the natural health kind of impacts, and how they really are demonizing the use of medication. And it just makes it confusing and scary for owners when their dog actually needs some help. What do we do? I'm afraid, all of this. And so providing a good foundation for scientific information from a specialist, I think is really key in this particular time.
Yeah, I agree. And I love that. I've already sent a number of my clients to
Oh,
it. So
good.
yeah,
Yeah. Yeah. I mean, so the big change that I had for this year was to expand my platform to include information for groomers and then also for pet owners. So there, toward the end of this year, the launch, this is the year of 2025, but toward the end of this year, there will be hopefully the pet owner course will be available, and this is just going to review how to think about allergies and what are the options, because it's definitely not one size fits all. And I think that is such an important message for us as veterinarians to give owners. Like, there's a lot of ways to handle this. It's not just Cytopoint and a bath for everybody. In fact, that's not going to work for a lot of dogs, right? So, and why? Why? There's a reason. And so helping people understand that is key. But if I do say so myself, it's a great platform because it just helps the masses. We have so many questions about this really, really common topic. So I'm happy to be able to provide something that's fun and interesting, and also grounded in science in the real world.
Okay, so I have another myth versus fact. Inflammation drives infection.
Oh, fact. That's my motto. So the Allergic Dog we have a few mottos, or I have a few mottos. And the first is inflammation first. So that is the way that I think about pretty much all infection, is asking myself, why? Why is this infection here? And the other way to think of it is, what has caused the shift in the normal flora? So right now we're in this really cool kind of shift, I think, in our thinking in general, we being doctors in general, human veterinarians, doesn't matter, to remember that the body is not a sterile organ. We do have areas that we don't want infection, but there's bacteria, fungus that lives with us and lives in our companion animals all the time in health. And this is normal. And so we call this our normal flora. And what happens when we have infection is the normal flora has shifted due to some sort of outside force. And most of the time, that outside force is an inflammatory force. Allergies being the most common reason why dogs are going to have an infection in their ear canal. But certainly there are other reasons why dogs might have infection in their ear canal. But all of those reasons tend to be inflammatory. They cause some sort of inflammation that's setting off the secondary infection. And so we live a bit in, one of the blind spots or traps that I teach about is thinking about infection first, just doing more antibiotics, more cultures, more focus on only the infection. And inevitably, that leads to a situation where the infection just doesn't go away. And the reason is because the reason the infection is there hasn't been managed, hasn't been solved. And so doing both at the same time is really important. So yes, what is causing this inflammation? Why is this infection there? Those are going to be two things that, Emily, as you're starting your career, if you ask yourself those questions before you even pick up a prescription for an antibiotic, your patients are going to do very well, because that is just a key foundation to have.
And so, what are you reaching for with regards to inflammation? I know a lot of veterinarians are afraid of prednisone. Are you reaching for things like Cytopoint, Apoquel, Zenrelia, or is it always prednisone to get that inflammation under control?
Katie, great question. Oh my God. It's like, this is how much time do you have? So, okay. When it comes to inflammation, we want to remember that inflammation is on a spectrum, just like everything else. There are some patients that are going to have very mild inflammation. How that's going to appear is very mild erythema, very mild clinical signs, very mild secondary, maybe even dysbiosis. Maybe there isn't even an inflammatory response to the bacteria or yeast. Maybe it's just an overgrowth or a dysbiosis. So it's kind of like on the edge. Then we have moderate inflammation, where now you're starting to see hyperkeratosis. Maybe you're seeing a lot of lichenification because the dog's licking. You have more advancement of the inflammatory process. Then all the way up to severe, where the dog is, just a walking seborrheic, lichenified, infected, smelly mess that really needs some help. So, on that spectrum, you're going to look at the options that we have for medical management of inflammation, of which there are 4, not 5 options. Cytopoint is an itch therapeutic. So, Cytopoint has no anti inflammatory properties. Cytopoint targets IL-31, which is an itch mediator. So if we're reaching for Cytopoint when a dog has inflammation, the only thing we're going to change for that patient is the amount of itch that is associated with that inflammation. We're not going to help with any part of that dog's inflammatory profile for their secondary infection. So then Apoquel, Zenrelia, Atopica or cyclosporin, and prednisone are in the toolkit to manage inflammation. And what we have to do then is pick a therapeutic based on the profile of itch and inflammation that the dog has. And I lay this out very clearly. I have a little graph. This is exactly what I help clinicians understand for each patient relatively quickly too. And I have tools that I'm building to help veterinarians understand kind of in the moment to make these choices based on the itch profile and the inflammatory profile that a patient has, what therapeutic to pick. If the patient needs prednisone, they need prednisone. If they need prednisone, you're giving them Apoquel. It's just not that great for them. Don't be afraid of medication. Just know what the side effects are, know what the limitations are, know what the contraindications are. We can do this. And then your patient's going to get better. And it's going to be way more rewarding than giving them Cytopoint and Apoquel when really they just need Atopica, or when really they need a prednisone reset and transition to Atopica or something along these lines. So is that easy to do? No. Does that require practice and a lot of knowledge? Yes. But that is very specifically the message that I've been wanting to help people with, because it's not that hard. It just requires a few understandings of the capacity and what is this drug doing? What is the actual purpose of this medication? Because then you can apply it to your patient if they have those same exact needs. So did that answer?
Yes.
Can I ask?
Yeah, good. Okay. Because I could talk about that one for a long time. So I was like, am I losing them? No,
Nope, I
the
get
answer
that.
is no. Yeah.
You answered my question, but Emily has a question for you.
Yeah, I was
Good.
just thinking when we were talking about the different, steps of management, some of those derm cases, like those hot spots that are really pussy and they look really painful
Yeah.
and just upsetting, I guess. If we're
Mm-hmm.
using anti-inflammatories, we're obviously not using pain meds. Is there ever a case where we're using an NSAID as an anti-inflammatory and a pain management rather than jumping all the way up to pred or cyclosporin is there ever a situation where you would do that?
Great. So in general, no. So most of the time, the pain associated with the inflammation caused by allergic disease is going to be far more responsive to the effect from prednisone than it is to the effect from a non-steroidal anti-inflammatory. And this is due to the underlying pathology. So if you understand the pathogenesis of atopic dermatitis and the mediators that are involved, you'll see why prednisone and the many targets that prednisone has is more effective for that process versus the COX-1, COX-2 inhibition that we're going to get from a non-steroidal. It might help a little bit, but it actually is going to really backfire on us because the patient's probably going to have some improvement with their pain, but then their disease itself is still going to be there. And so then you need this washout for 3 to 5 days minimum in order to then transition them to prednisone at the end of the day, right? So I strongly encourage vets to not reach for non-steroidal anti-inflammatories for their skin and ear cases because the impact of that therapeutic is not really targeted to the actual disease that we're trying to impact. In some cases of anal gland abscess, I do think that non-steroidal anti-inflammatories are more effective, in particular for the ones that are not associated with allergies. And there is a very fine line. We don't know a lot. This is what I'm working on now with my anal gland course called Beyond Expression. The the though there are cases that have an abscess out of nowhere. These are not allergic dogs. They have, basically a 1 minute normal anal gland, the next minute abscessed out the skin. And we're treating those with appropriate empirical antibiotics and a 3-day course of nonsteroidals, and this never happens again. In that kind of case, I do think the pain associated with that cellulitis is appropriate to use nonsteroidals. But there's a fine line on that too, because a lot of anal gland cases are in fact driven by allergic inflammation. And so it is potentially better to use prednisone or infusions, which is one of the things I teach. And so, yeah, I think that there's very few, like I can't tell you the last time I reached for a nonsteroidal. And I would encourage vets to not think of prednisone as this like big therapeutic, right? We have to remember prednisone has a dose range from physiologic through a very wide anti-inflammatory therapeutic window to an immunosuppressive protocol level. And so we're not immunosuppressing these patients, we're just reducing inflammation. And so it's not, you don't have to worry about the massive impact, the big gun that prednisone is, because we can use it at a nice anti-inflammatory level. But for your hotspot, that's inflamed and purulent, using an astringent like Dumboro astringent, which is an aluminum acetate astringent, works beautifully. Sometimes topical therapeutics are enough. Sometimes you have to increase to oral antibiotics. Sometimes you need to increase to oral prednisone. So again, all in context of the patient, the severity, and the generalization of their lesions.
That's a really great question, and I hadn't really thought of the NSAID in a hotspot case since probably like when I graduated as well, because yeah, you think the dogs are painful, and prednisone sometimes feels scary when you get out of school. What so you mentioned the large dose range. What would be your go-to like tapering course of prednisone for a hotspot that needed it? Like I think in school we learn, you do BID for however many days, then SID for however many days, and then, every other day. And I feel like once you've been out of school for a long time, you don't really follow that anymore. At least I don't. Like I kind of just tailor it to what is needed. So
Yeah,
sometimes I'll just do once a day, and I find sometimes bigger dogs pee way more on prednisone, so I cut them back a little more than the little dogs. So yeah, what do you do in those?
totally. Yeah, you want those answers, when you're first starting and you want more guidelines. I do think that what's important is not to be too quick. If you're just in and out, you're going to have relapse. And so a slow taper over 2 to 3 weeks is really where I would put my mind. And then you want to base it on the weight of the dog, other kind of just like the characteristics of the animal. If it's a really large dog, is it going to drink forever? Is it 9 years old? Is it 2 years old? These are things that are going to help you decide if you need to be on the upper end of an anti-inflammatory dose, closer to a mg per kg, or if you can do something like 0.5 mg per kg, 0.3, how does the tablet size work? How cognizant is the owner of what a taper even is? All of these things are going to come up to play when you're designing these taper protocols. But, I saw a case the other day and the owner was like, oh gosh, no, he didn't respond to prednisone at all. And I pulled the records from the primary care and it was a 5-day taper. And you just can't write home about that, for these chronic, allergic cases that are smoldering and very inflamed and widespread, et cetera. You really need to think long term, and not necessarily think long term with just prednisone, but you do need to think about the impact that this short taper is really going to have.
Okay, good to know. Do you have anything that jumps to your mind as like something we haven't really touched on yet, or something that really comes as a like constant that you're seeing in referral that maybe we can combat?
I think we could talk about supplements and we could talk about allergy tests.
Okay, let's do it.
Good.
Yeah.
Yeah. Okay. So yeah, something that comes up quite a bit is the use of supplements. I think that right now pet owners are inundated with social media messaging about the use of supplements to cure all ills. And, what's happening is we are seeing the creation of basically a company every day, it seems, that has a marketing budget to beat the other company that was created yesterday to put up more reels and Instagram messages and things that help owners feel as if they must buy this product. It's going to cure my dog licks his paws. Oh my God, it must be from yeast in his gut. And I'm going to use this chew and it's going to solve this problem. And for $45 a month, we're going to get this shipped to us and we're going to complain to our vet that the bill was too expensive. It's just, it's awful, I think, what's happening. And the reason it's awful is because it's not rooted in science or evidence. And the grand majority of these products are producing subclinical products. So the ingredients are not necessarily harmful for dogs. So I wouldn't say that at all. It's just that the doses that they're including of the ingredients that they're putting into the supplements are very much below the clinical recommended guidelines for treating inflammation, for joint health, for vitamin support, etc. And so if you do your research, if you're a pet owner listening to this and you really want to know, what does my dog's chew really have in it? Look up those ingredients and then look up the dose of what is recommended. And you'll see that it's maybe 5% of the recommended dose for maybe an anti-inflammatory fatty acid. Probiotics. God, nobody has any evidence that probiotics help atopic dermatitis right now. I suspect 10 years from now, when we record another episode of this podcast, that we will have better evidence that probiotics help. There's no doubt that the gut is related to everything. We're all connected. It's not just like, well, my gut's over here and my skin's over here. No. But how much does the lactobacillus that your dog's putting in this chew that's kept at room temperature, probably, digesting it, probably isn't making much of an impact for their allergic disease, certainly to the level that the social media posts are showing to you. So for vets, we're caught because owners want this stuff. And why they want it is because they want a quick fix. They're frustrated and they're seeing things and they're seeing these comments, et cetera. So I think for vets, it's hard because you want to get frustrated and you want to be like, like, why do these idiots keep looking at these products? And then they're complaining to me about how much Apoquel costs or whatever. And just remember, like, that's true. Like, it's annoying to be unsure and it's annoying to have to feel like you need to look to the internet, to get answers. And so just leveling with people, like, I'm just like, yeah, I know they get me too. Like, I see these posts, I see these videos and they're so good. But unfortunately, if you really dig deep, they're crap, or this product isn't useful. Might be useful for mild cases. There are some dogs maybe that are quite mild that are going to maybe do a little bit better with some fatty acid support. There's also a known placebo effect in veterinary patients. And so maybe that's it. But overall, a patient like this kind of dog who's just suffering so much, like, I really want to make sure that, one, you spend your money wisely because this isn't going to be, inexpensive. And then two, that we're actually using something that's going to help. And so let's talk about what some of those options are and try to avoid getting frustrated by it because it's so pervasive right now. And I don't think it's going anywhere.
Yeah. Yeah.
I think there's something to be said about the social media marketing in general because it kind of takes that barrier out for a lot of, especially our younger, generation that is on social media all the time. And it helps them feel like they're connected to whoever it is that's selling, whether it's an AI vet that's sitting in the bottom screen saying, I've solved all the problems. because, they feel like they're being heard. But having a blog that, you've created for pet owners will also kind of bridge that gap so pet owners feel like they're being listened to and that people are on their level and that we do understand that this is frustrating and can feel like not demoralizing, but like, I'm getting defeated as a new grad, seeing
Absolutely.
I'm feeling
Yeah.
like I can't help you and I want to help you. I know what level you're on. And so that supplement that feels like, oh, I can just do that one little thing. Like they feel like someone is, with them on the same level. And I think that unfortunately the marketing is very good and the vet med
I
marketing
think that's
is very
that's
good.
such a great, yeah, that is such a great point. And another is if you look at some of their, one of the things I tend to do is read through the comments, and you'll see so many of them are just like, this saved my dog so much better. And like, who knows if these people are real, right? First of all, like we don't, and we don't know what tactics these companies are taking. And I'm not here to like slander a company or say anything. I'm just being honest. Like, I don't know the answer to this. And we also know that we can't trust everything that we're seeing on social media. But then another thing comes up in the comments, in especially on some of the more like natural veterinary websites and podcasts, where they'll say like, never use this option. This is going to kill your dog, or like, this is a bad medication. If you look in those comments, you'll see real people saying, but then what do I do? Like, if I can't use this, my dog's miserable. And now I'm just sitting around afraid and I don't know what to do. And that I think is also a major problem that we all as vets need to really tackle head on and be like, I get that. There's a lot of this messaging, and what's important to know is that for some mild cases, we might be able to get away with baths and maybe something like Cytopoint, something maybe even just an antihistamine, but that doesn't help the majority, especially a dog like Fluffy, who is, I would put, more moderate. Now we have to really think about some of these other options. And I get it. I want my job as your dog's vet is to keep your dog as safe and as comfortable as possible. And I'll do my best to provide that, and just to counter those messages without getting frustrated. Cause it's so easy to just be like, like, this drives me crazy, come on. And I feel like it gets very black and white and people feel heard, but then they feel frustrated because it doesn't work.
Yeah, totally. I agree. The in-depth of those appointments, like how detailed you need to be, how communicative you need to be is like another level. Like it just you sometimes don't have enough time to go through this, condition if nobody's ever listened to or heard this client about these problems for multiple appointments. Well, then you've got a lot to unpack, right?
Yeah.
And so like just trying to get a framework around that is super challenging. But yeah, like building that bond with the client.
Rapport and trust.
Yeah.
Yeah.
Yeah, I think it's really important, right? And just like being honest about the fact that like this is like allergies don't go away. There is no cure for them, but we can manage them as good as we can if we're working on the same team, right?
Absolutely. Yeah. And we don't have to be like burdened by, like, there is burden. And I don't want to, like, caregiver burden is huge in allergic management because pet owners, like, think about all the stuff they do. Like, I think another thing I try really, really hard to do at least like once a week is to have almost like a little moment where I imagine my own dog had just some of the manifestations that I see in my patients and how hard that would be. Like, really, like, I like to like kiss my dog and like get all up in there and like, hug her, cuddle, or pet any of these things. And for some of our patients, that's not even really possible. These owners are grappling with a pseudomonas otitis that's horrifically smelly, and their dog's skin feels like leather, and they're scratching all the time, and they're licking their paws, and no one's sleeping. Like, that's a lot.
Mhm.
And so, really understanding that there's a burden to allergies, even though it's not a life threatening condition, it is very life impactful for everyone involved. And so, helping to manage that, on that spectrum of, mild to severe is so important and really hard, really challenging for vets. But that being said, if we understand how to utilize medication and how to work up root causes, we can really get somewhere with the condition. So it's both. It's hard and okay.
Yeah. And it's super rewarding. I find the skin cases like the actual, like there's something that you can fix.
Yeah,
Sometimes it's not, right? Sometimes you can't fix what you're seeing, but with skin, like you can provide people with the tools they need to improve the condition. And so I find the dermatology cases like pretty rewarding because of that. Even though they take a lot longer, even though it involves a lot more follow-up and like communication and, managing the flares and all of that. I find like you really get to that like rapport a lot faster when you are listening to what the clients are concerned about and you're actually actively trying to solve the problem, which like not 100% solved, but at least solved to like way better on the itch scale.
for sure. I love to hear that you feel that way. That's great.
I guess the last thing we should touch on is allergy testing. We have offerings for blood allergy testing, myth versus fact. I guess last one of the hour. Um, Allergy testing by blood is a useful tool for managing allergic dermatitis.
That's true. And the reason it's true is because it's one of the tests we have available to determine what to put into immunotherapy. And that's it. The value of the test is not to make a diagnosis. And that is the most common myth. Can't we just test and figure out what he's allergic to? Yep, kinda. Yep. In this moment, right today, we can test and draw blood and find these antibodies and can make some sort of kind of overarching thoughts about that information. But the problem is that most of the time, the results of this test are not going to yield any information that's actionable in terms of lifestyle modifications, right? If we have 7 tree pollens and 6 weeds and dust mites and some molds, you basically are asking to now say, okay, go live in a bubble because these are things that are pervasive in the environment. And so the information that we get from an allergen panel is only useful to design an allergy specific immunotherapy vaccine or oral immunotherapy for a patient. And so that is the single most important message to hear about testing is that it's not useful as a diagnostic test. It's not done to determine if a dog is allergic. You unfortunately cannot say, okay, I have a dog that's itchy and I don't want to spend time, or the owner doesn't want to invest in doing the diet trial and they just want to know. And so I'm going to do some testing. It just doesn't work that way. It's not like a CBC where you get back a number and you say, okay, the hematocrit is X. It is unfortunately a bit of a moving target and it has to be put into the context of the patient. And then it has to be used to design a custom immunotherapy prescription for that patient. And so if the owner is not interested or willing to do immunotherapy, then allergen testing shouldn't be done because there's just no value to it at all. It's a complete waste of money. There's just nothing you can do with that information. In fact, I think people just get depressed. Like, I think it backfires. People are like, oh my God, he's allergic to so many things. And it's like, yeah, I told you. And so really the first step, get your food answer in a non-seasonal patient or a season, patient you need more information on. And then from there, ask, okay, are we interested in managing the root cause of environmental triggers with immunotherapy? If so, we can do allergen testing. Blood testing, the question of which lab, who to use, how to think about that, the decisions to make by your clinic, what you have available. There's some nuance to that. And this is something that I think is beyond the scope of the discussion on this podcast, but it's definitely one that I talk about in my courses. So definitely if that's an interest and you want to do more immunotherapy, but you just don't know how, that's something I can help you with. But it is important to know that not all tests are created equal, and that when it comes to skin testing versus blood testing, the purpose of each of those tests is still the same, and that's to get an immunotherapy prescription. And so overall, patients do pretty well on immunotherapy prescriptions that are designed by serology tests or that are designed by skin tests. It's just a matter of really who's managing that immunotherapy that seems to have the better outcome. So you really have to know what you're doing when you're starting that immunotherapy. And that I think is the hardest part for GPs, because they're not in the zone for that. You're not set up for that. You got to order the immunotherapy, all of it. If I could clone my, I would create a whole other company that dealt with that, but I just don't have time right now. But it is an interest of mine because it would make it easier for you, and I think the more dogs that are on immunotherapy that are well managed with that immunotherapy, potentially we could see, better control of their symptoms, et cetera. But testing, just don't think of it like a test. I wish it had a different word, because it's information. It's information utilized for immunotherapy.
I think everything we've covered today has been super useful clinically, and I'm sure we could find, multiple more hours to discuss dermatology, because let's be serious, there are so many different facets, and like you'll see it, like we talked about, in many, many appointments throughout your day. Before we wrap up, I wondered if Emily had anything kind of come to mind additionally, or kind of do you feel ready to jump into clinic next week and tackle all your derm cases from the root problem, which is inflammation?
Yeah, I guess my only question is I did my externship up in the Yukon, which is very northern Canada. So we had like no referrals, nothing, and we saw quite a lot of skin cases. And for me and the other doctors, it felt very daunting seeing those cases. And some of the ones that were more like autoimmune in nature, if there is no option for referral, like in person, are there resources people can access online, or a way to contact people to send in those like scarier, more in-depth derm cases to receive like peer-to-peer support?
Yeah, I mean, I think most dermatologists are happy to provide help. So there's a lot of us online, myself, the derm vet, there's several other, kind of online presence dermatologists. And so follow us on social if that's your thing, get our email and just send us an email. People are welcome to message me any case, really. Like, I'm happy to be like, okay, here's the top things you need to think about with this, or here are my differentials. I also think that it's important to have I honestly really love one of my textbooks, and it's I don't even know the title of it, but we link in the bio or whatever,
Yeah, we'll link
or
it
a
in the
link in
bio.
the show notes. But it's Henlika's, I don't even know how you pronounce his name. It's so funny. He's a dermatologist and he wrote a book, and it's so good because what it is very simple, very basic review of each disease, but it has nice clinical photography. But then it has the primary lesion, and it has a list of differentials based on those primary lesions. So pustule, and then it'll have like a list of things that cause pustules. And, it'll have whatever, like it just has a list of primary lesions. And then like follicular casts, for example, and I have like, sebaceous adenitis. So it is a book that can, there's also breeds. So if you're like, okay, I have a Dalmatian in front of me and it has this, what are the 4 things that I need to remember that Dalmatians get? So if I'm seeing a dog breed that I don't see that often, like a Leonberger's coming in, sometimes I'll open that book and be like, are there any things about Leonberger's that I need to make sure I don't forget? And so I find that book to be the single best clinical resource. I'll be honest. There's other textbooks out there, but I use that book still. And it is nice because it's a 1 page on like the disease, 1 or 2. But even like if you read that first chapter of the disease of the book, you'll have a better understanding about how to approach some of these cases methodically, because it's really about what is the lesion, what is that primary lesion, like the first thing that's coming up, and then what disease process could even cause that lesion. And then from there, you can start your kind of diagnostic process, because it's overwhelming, but at the same time, you still can use your diagnostic mindset and approach these cases systematically. And then, potentially use other diagnostics like cytology or maybe biopsy in order to get some answers. So, it can be tricky, but I think it's a process of pattern recognition, and pattern recognition takes time. You have to see a lot of pattern, a lot of input to have your patterns. And so That book I think is very helpful because it reinforces some of the patterns that you'll see. So I'm happy to share that textbook. And I'm sorry that I don't know how to pronounce your last name to the author of that textbook, but it's like H and then N, and I just don't know what to do with that. And but thank you for creating such a great textbook. I've actually sent him an email to be like, I use your book all the time and I love it. So I think that's a great place for new grads. I would get that book, and I whip it out in the exam room. So, which is funny, like, you can't really do this when you're new because then they're going to be like, she's a mess and doesn't know what she's talking about. But once you're like past 5 years and you're more confident, then you can be like, look, I'm just going to check and see if there's anything else I need to be thinking of for your case. And I'll be like, see, like, I really feel like this is what we have going on, et cetera, et cetera, et cetera. So, yeah, it's something that you can choose whether or not you want to be like, I'll be right back, and then go and look at the book in the corner and like the back of the treatment area, or if you're going to actually look at it in the exam room. But yeah, it's helpful.
I did that the other week. I brought a textbook in. Like, I have this one case I've been dealing with for a long time. It's a skin case, and it's like a really crusty Cocker Spaniel. And anyway, I brought the book into her to be like, and I've known this client for years and years. So like I brought the book in and I like brought up the page on like that primary and secondary summary, and I was like, okay, I think we're here. But like, you're totally right. You can't do that when you're
Can't do it when you're new. Yeah.
She this client like knows that I'm like helping her dog and knows that I mostly have a good idea of what's going on. But anyway, so yeah, good point.
It can really help reinforce some owners to be like, this is it. Like, it's literally in the book. Or it can put people off on, they're like, this lady's a mess. Like, I still see cases though, like that I am like, I mean, I think this is it or this. And like, I'm very methodical. So one thing, okay, here's another like pro tip for you as a new grad. This is a whole other podcast though, FYI, is that it is okay to like okay. When I was a new intern, I was cage side and I prescribed Baytril and I had no idea why. Okay. So then the internist who I was working with at the time said, Dr. Rock, that was my maiden name, Rock. It was a great maiden name. I really struggled with whether or not I should accept my married name, which I decided to do. Anyway, Dr. Rock, what is your diagnosis? And I was like, I actually have no idea. And she was like, you're a mess, basically. And she said, our business as veterinarians is to make a diagnosis. If we don't have a diagnosis, we have nothing. And she's right. And the most important thing to remember is ask yourself, what is my diagnosis? And if you're like, my diagnosis is yeast, like, just, you got to back up and remember that that is secondary to something else. So what is the diagnosis? And for skin, your primary lesions are going to help you understand more about what is causing this lesion. And then for anything else, what is my diagnosis? Is it that the bone is broken, or is it a neoplasia? Like, then you can really start getting to make sure. Because if you don't know your diagnosis, you're never going to know what your prognosis is, how to treat it, all of it. Everything comes from that.
Well, I think we have already established that there is a potential for a second podcast after this first one. Maybe if anyone has questions, they want to email in, and if we want to get this set up for another like round two, I think that would be really cool to do a Q&A on like common derm questions. I think that'd be really useful. But we really appreciate your time. You are a wealth of knowledge. I would like to come down there and follow you around in Boston for like weeks and just like get better, because I think that's the thing. Like, we can do better for these allergy dogs, and I think we really should be pushing because we're going to be seeing more and more and more of them. So find a way to get the CE, to learn about it, because it's not going away and we cannot ignore it. And so just find a way to be better and help those dogs in their day to day.
Yeah, you're welcome to come and hang out. That'd be really fun. And yeah, if you can't hang out, then you can hang out with me online, and definitely checking out my courses and social media. I'm in this like point of being really nervous to start doing some like reels and like talking to the camera, etc. So I appreciate everyone's support. And it's just like, I'm a real human being. I literally do this in my attic, which is where I am right now. In my spare time, I have a kid, life like everyone else. And, it's just a matter of like, it's really fun for me. And it's definitely, part of the reason why I'm here on this earth for this small little period of time and this amazing life we get. So, excited to make connections with all the other real people that are out there, and appreciate you guys listening and tuning in and being able to come on this podcast. Thank you.
Yeah, thank you so much again. And we'll catch everybody next time on What's Up Doc.
See ya.